I'm Ashley White from Newport News, Virginia. I had carpal and cubital tunnel release on both my arms. Prior to surgery, for years I had been dealing with pain from typing at work, and I tried to treat it with bracing, and I did that for quite a few years, up until this past year where I started losing grip, not able to open pill bottles, starting having pain with holding my toddler, not able to pick him up, and really experiencing a lot of pain, particularly at night after working a long day. Yes, I decided that it was time to look into what the cause of the problem was, as opposed to just temporarily treating it. And I went to another practice. They diagnosed me with tennis elbow and gave me a cortisone shot. It worked for about 3 months, and then the pain came back. So I decided to come to OSC and see Dr. Haynes to see what his opinion was, and that's when he diagnosed me with carpal and cubital tunnel. He seemed very knowledgeable and very quick to respond to what my symptoms were. He knew immediately, without even having for me to finish what I was describing were my symptoms. He immediately rattled off what my pain was. He told me what I was going through, which was shocking but relieving at the same time, because he knew immediately. Dr. Haynes decided, and I decided, that the best course of treatment for my situation would be to have surgery on both my left and right arms for carpal and cubital tunnel release. We decided to do my right arm first, so I had that done almost 2 weeks after we decided that that was the best course of action. The recovery time was about 4 to 5 days. I was back at work, and it was about 4 to 6 weeks for full recovery on my right arm. That was definitely the more difficult arm. My left one I actually had done 2 weeks ago, and I returned to work 4 days later and immediately started working on my range of motion, and now I've gained back full access. I can pick up my toddler now, which is a relief for him, and I'm back to work and doing all of the things that I was doing before, but without the pain. I'm definitely sleeping better, for starters. I'm not waking up from pain, unable to go back to sleep. I'm not having to take pills in the middle of the night or having to shift pillows. My toddler is thrilled because mommy's not telling him that she can't hold him. It's certainly difficult to tell your child that you can't hold them and comfort them. So, I can be mom again, which is, my #1 job, and makes me feel fulfilled again. And then, of course, at work, being able to reach my full potential and do my job is definitely important to me, and it feels great not to have pain and not to have to stop my coworkers or colleagues or vendors or clients mid-sentence so I can relieve my hands or massage a muscle or something like that. So it's been good. I definitely wish that I had done this when I started having the pain, instead of trying the other options. I think we all try to take the path of least resistance and delay surgery, but if I could have hopped in the bed a couple years ago, then I definitely would have. Of course, we all don't want to go through surgery, but it has definitely been the easiest procedure that I've ever been through, and I've been through quite a few. So I would say don't hesitate, because Dr. Haynes is by far one of the best doctors I've encountered, and you're in great hands when you're with him. So.